Hello, everyone. It's a pleasure to be conducting that webinar. I would like to thank Clarion Technologies for arranging for that. Today, we are going to discuss the radio frequency in skin rejuvenation and tightening using the OnDemand device. My name is Ashraf Badawi. I am a dermatologist from Egypt. I'm the Vice President of the European Society for Lasers and Energy-Based Devices and the President-elect of the European Society for Cosmetic and Aesthetic Dermatology. It's my pleasure to be presenting today. If you have any questions at the end, please post it and I'll be very happy to respond to the questions. So when we talk about radio frequency, skin rejuvenation and tightening, I think this is becoming a big demand. Everyone wants to have younger looking skin, younger looking face, and this is becoming a very popular demand in different clinics and med spas. If we look at the market, we are going to find that there are so many technologies which are used for skin rejuvenation and tightening of the skin. However, there are some demands which have not been met yet. So why do we need another aesthetic technology? Actually, we are sometimes facing patients who are having dark skin and they have some complicated issues. And with those patients, we are not having the free hand to use anything. We have to be careful when choosing the technology we are using, so it has to be color blind so that we don't cause a problem or complications which are going to take months and sometimes even years in order to fix. Sometimes we have a challenging problem like large pores. Large pores is a complicated issue. It is not as simple as many people are thinking, and in order to improve large pores, we are supposed to be dealing with the epidermis, with the dermis, and with the subcutaneous tissue in order to tighten the skin, in order to stimulate the collagen, and in order to improve the barrier function of the skin. So to have a technology which is able to perform all those steps and actions in order to improve the large pores of the skin, this is not an easily found technology so far. Large pores on the nose is another problem where fractional laser might be a good solution. However, with fractional lasers, we can see higher incidence of hyperpigmentation, especially when we are treating dark skin. Also, the downtime is another issue. So we need a technology which is able to deal with the large pores of the skin in a professional way, in a safe way, and in an effective way. Sometimes we have multiple issues, multiple complications, multiple skin problems. Like, for example, in these patients, we are having active acne, we have post-inflammatory hyperpigmentation, we have some acne scars, we have some skin laxity, textural issues. So we have a group of problems which needs to be solved. And in order to do that, we have to use a device which is able to work on the different aspects of the skin safely and effectively at the same time, and it shouldn't promote or stimulate more melanin production in dark skin. So all those are challenges which we sometimes stay in front of helpless. Another problem is the stretch marks. Stretch marks, till now, we are not finding a solution which can resolve it 100%. However, if we use the right tools, then we are able to improve it 40 to 60% with the right combination of treatment. And we have to do that while avoiding developing post-inflammatory hyperpigmentation in darker skin types. So again, all those are challenges which we are facing in the daily practice. And if we don't know how to tackle them, how to use the right technology in order to deal with all those problems, then we are facing a problem with our patients. One of the most effective treatments for deep wrinkles is the resurfacing. However, resurfacing is associated also with significant downtime. And if the skin is dark, then we have high incidence of hyperpigmentation. If the skin is fair, then we have high incidence of prolonged erythema. It is true that it is giving very good tightening, very good rejuvenation of the skin. However, this is coming at a cost of significant downtime and high incidence of complications and side effects. So the key clinical demands in the market now is to have a color-blind technology which is safe on all skin types, with proven clinical effectiveness, with minimal downtime, and with consistent results. I cannot use a technology which will work on 20 or 30% of my clients or my patients very effectively, very safely, and in the rest it is either going to be not effective or producing significant amount of side effects. So we need reproducibility in whatever we are using. So my belief and my practice is rejuvenation first, and this is something which I would like to spend a few minutes on explaining, because when we are having someone who is complaining of volume loss, so the easiest thing to deal with that is to inject fillers. However, fillers are not going to improve the structure and the function of the skin. It is going to improve how the skin is looking temporarily, but then it is not stopping the process of aging. By the time this filler is going to be absorbed and disappears from the skin, the situation is going to be worse because we didn't improve the skin. So rejuvenation means restoration of the structure and the function of the skin, and with that we are getting improvement in the appearance of the skin. So this should be the priority, rejuvenation. So whenever we have patients who are having structural changes and defects, this is something we have to work on and improve. And then we can fine touch using the injectables. Dynamic wrinkles will not improve except with the injection of botulinum toxins. However, if we are able to improve the elasticity of the skin, if you are able to improve the hydration of the skin, then the efficacy of the neurotoxins is going to be prolonged and it's going to be more natural looking. So that's why we have to focus on rejuvenation, restoration of the structure and the function of the skin as a priority, and whatever coming from outside the body should be having a second priority. It has a role, however, the role is not in the beginning. It should be after fixing the structure and the function of the skin. So we have to remember that the skin is composed of three layers: the epidermis, the dermis, and the subcutaneous fat and tissue. And this is something which we have to remember because each of those layers is having certain structure and function. And with aging, we are going to see some changes in the structure and the function of each of those layers. And this is going to be reflected on the appearance of the skin, and we start to see the signs of aging. So if we start with the epidermis, we are going to see that the epidermis is composed of 35% corneocytes. However, so 35% corneocytes and 65% living cells. However, with aging, we are going to see that this ratio is going to be reversed. So we are going to see that the corneocytes will increase from 35% up to 60%. And this is happening on the expense of the living cells, which are going to be diminished to 40%. When that happens, when someone is having this structure of the epidermis, they are not coming to complain of hyperkeratosis. They will not come to tell us, I have hyperkeratosis, please treat me. No, they don't know what hyperkeratosis means. They are going to tell you, I feel that my skin is dull. It is not fresh looking. And why is that? Because when we have increased number of corneocytes than the normal, then the living cells are going to be diminished. And when we have less number of living cells, then the nutrition is impaired. So the skin is looking dull. It is not looking fresh and young. This is number one. What about number two? When the epidermal structure is like that, we have too much hyperkeratosis and too less living cells, then the second complaint is going to be using the best brands of skincare products, but yet it is not effective. And why that's happening? Because when we apply skincare products or active ingredient on epidermis like that, we are going to see that it's going to be absorbed by this huge number of corneocytes, which are dead keratinous cells, and this is not going to be utilizing those active ingredients, active products. And whatever penetrates will find less number of living cells. So the number of living cells in this case is going to be much less than normal. So the cells which can respond to those active ingredients are less than the significant required amount. And this will decrease the efficacy of the topically applied skincare products. The third phenomena is in the next slide, where we are seeing that the overcrowding of the corneocytes will not allow epidermal barrier function to take place, because when the corneocytes are too crowded, they are unable to overlap. They are going to be having some gaps in between instead of sealing the skin well like this. So we can see that there are some gaps and cracks in between the corneocytes, and this is going to allow the transepidermal water loss. The skin is vaporizing the water, and when the skin is vaporizing the water, then the skin is dehydrated, and with the dehydration of the skin, we get skin elasticity impairment. When we have skin elasticity impairment, those people are going to complain that the skin is becoming very sensitive. They are having irritation of any skincare product where they didn't have allergies or sensitivity before. They are going to complain that the skin is becoming rough instead of being smooth. Smoothness of the skin depends on the normal keratinization and the intact barrier function. So once the barrier function is not intact and there is transepidermal water loss, the elasticity is impaired, so the skin will lose the smoothness. And also at this stage, the pores are becoming larger, and we are going to see fine lines and wrinkles because of the impairment of the skin elasticity when the skin is losing the water. So all those are issues coming from defective epidermal barrier function. The roughness of the skin, the large pores, the fine lines and wrinkles, and also the increase in the skin sensitivity and the easily irritated skin when we apply any topical agents. So all those are issues coming from the defects in the epidermal barrier function. So this is something which we have to consider. And when we have a defect in the epidermal barrier function, it is really very important to make sure that we are doing something in order to improve the epidermal barrier function, remove the hyperkeratosis, and stimulate the living cell proliferation. Just like any wound, when we have a wound, then this is stimulating the regeneration process and repair mechanisms in order to stimulate the proliferation of the living cells. So this is exactly what we do. When we remove some of the stratum corneum, this is going to stimulate the proliferation of the living cells, and we are able to restore the epidermal barrier function back. Now, sometimes we perform a small test where we pinch the skin of the dorsum of the hand. If it takes a long time to retract, then it is a sign of dehydration. Sometimes, even if we perform that test, we can see that the skin is retracting. However, if the defect is happening on the microscopic level, then it means that still we are going to see the problems I mentioned, like the roughness of the skin, large pores, and fine lines and wrinkles. However, if we are able to improve the structure of the epidermis, then all those issues are going to be resolved in a very nice way. In many cases, patients are coming to complain of things beyond the surface of the skin, like melasma or acne scars or large pores or wrinkles or laxity. However, if we look carefully at the epidermis, we are going to see that the epidermal structure is defective and it has some issues, and it needs to be repaired in order to see effect from any procedure we do beyond the surface of the skin. So if someone is having acne scars, it's not enough to do something to stimulate the collagen. It's very important to make sure that we did something to repair the epidermal barrier function, which is defective in most of the cases we are going to be seeing, because the epidermis is the main interface, the first interface with the environment, with all the pollution, with all the negative impacts of the environment on our bodies, it is met with the skin and with the epidermis namely. So again, we go back to the structure of the skin, the epidermis, the dermis, and the subcutaneous fat. We spoke about the epidermis. What about the dermis? We definitely lose the collagen. The collagen and elastin are the major proteins in our dermis. 90% is composed of dry weight of the dermis, is composing the dry weight of the dermis, and 40% of the dry weight of our subcutaneous tissue are made by the collagen and elastin. And after the age of 20, we start losing 1 to 2% of the collagen per year, and this doubles with the photoaging. So the areas which are exposed to the light in our skin are having less quality than the areas which are covered and not exposed to the light and to the ultraviolet. So we can see that this is my son. He has a much healthier and youthful skin than me, and he's teasing me that he has better skin than me. This is the case. This is how we lose the smoothness of the skin when we lose collagen, when we start to have epidermal barrier dysfunctions. So when we have a plan for rejuvenation, then we have to target the different layers of the skin. We have to target the epidermis. We need to change this structure of the epidermis into that one. So by removing a large portion of the dead cells, the corneocytes, this is going to stimulate the living cell to proliferate. So we are able to restore the structure to like this, much more living cells and much less corneocytes. So on the level of the epidermis, this is what we need to do. At the level of the dermis, where we lost the collagen at the level of the upper dermis, here we can see that it's very faint. There is no collagen bundles. So we need to do something at the level of the upper dermis in order to stimulate the collagen synthesis and have collagen bundles regenerated and resensitized in the skin. So this is something which we have to have the objective of collagen induction therapy or stimulating the collagen synthesis, and we have different procedures to do that. And at the same time, if there is a degree of skin laxity, it's very important to induce deep tissue heating. With deep tissue heating, we are able to tighten the skin. So in a case like this, sometimes the patients are not aware of the fact that they have skin laxity. So it's very important to examine the skin well, explain to the patients the different defects and issues they have at the different layers of the skin, and then build or design a rejuvenation plan to address all those issues with the appropriate technologies which we have in our hands. So in a case like this, we definitely need to tighten the skin, but tightening the skin is not enough. We have also to stimulate the collagen, and also we have to improve the epidermal barrier function in order to get complete long-term natural result for this problem. So what if you don't do anything about collagen loss? We age, and with aging we have all the manifestations of skin aging, like skin laxity, large pores, wrinkles, pigmentation, photo damage, and so on. So if we don't do anything, then we are going to go through that path, and we are going to have aging. And this was the norm. This was the case 15, 20 years ago, where there was nothing being done to prevent or to stop the aging. So can we do something about it? Yes, of course. If we keep doing the rejuvenation procedures in the right pace, with the right techniques which are suitable for the skin of our patients, then over the years we are going to not only stop the signs of aging, but also revert it. So we can see that this is Dr. Patrick Bitter from the US, who was 43 years old in this photo, and then after 11 years he was 55 years old, as we can see, but his skin is looking much younger. So this is something which we can do if we use the right rejuvenation plan, targeting the different layers of the skin with the right protocols. Then we are not only stopping the signs of aging, but reverting it as well, and we are restoring how the skin was looking many years ago. During those years, those people got something like 30 years, which is not too much. In 11 years, when we have 33 or 32 treatments, this is 3 treatments per year, which is not too much. So this is another patient who was 38 years old in this photo, and then after 11 years, she's 49 years old, and we can see that her skin is much better looking than 11 years ago. So it is actually really a great achievement in our field that we are able to restore the structure and the function of the skin and achieve very good rejuvenation and maintain it for a long time. So when someone is growing older, however, their skin is looking younger, I think this is great achievement, especially when we are able to achieve that in a very natural way. This is the concept which I'm using in my practice, and this is what I encourage all my colleagues to implement in their practice as well. As in the dentistry, there is a specialty now called the dental hygienist, where they are doing a lot of procedures in order to prevent the aging of the teeth and the decay of the teeth and different problems. I think it's important to develop people who are specialized in collagen induction. So we are supposed to be collagen induction specialists. This is something which we have to do and implement in our practice in order to prevent the signs of aging and keep our patients looking younger for the longest possible. To study the role of the RF in inducing new collagen and elastin, several studies took place. One of them is this study about the bipolar fractional radiofrequency treatment and its induction of neoelastogenesis and neocollagenesis. If you look at this study, we are going to see that they studied the genes involved in dermal remodeling, and I would like to comment on 4 important elements in this study, which are the fibrillin, the tropoelastin, procollagen 1 and procollagen 3. If we look at the values of those markers in the control without treatment, and then how much they increased slightly immediately after the treatment. However, if we look at the value of those markers 28 days, 4 weeks after the procedure, we can see that they have increased really significantly, and this means that the effect we are getting from this fractional radiofrequency is not temporary. It's not due to edema or erythema, which is going to go away after some time. No, this is a structural improvement in the skin, which is going to stay for years. So one of the very nice handpieces the OnDemand device is having is the FSR, where we are able to deliver the radio frequency in a fractional mode without any ablation and without needles. So this is the FSR, where we have 2 clinical technologies in one application handpiece, where we are able to do very minute ablation, and in addition to that, we get volumetric heating. So we can see that the effect is going to happen on the superficial layers of the skin, in the epidermis and the upper dermis, and we can see that the effect is very controlled, as we can see in the histology. So this handpiece is having very good epidermal effect. It can penetrate up to 300 microns, and it is having 112 dots, which means that it's giving very good coverage of the skin in a very homogeneous fashion. It is associated with very low discomfort and minimal downtime, so it can work on all skin types without any problem. So the risk of PIH is much less than with other technologies which are not having the same features. This is one of the studies which talked about the histological and clinical evaluation of the FSR handpiece for skin resurfacing. So the fractional skin resurfacing using the FSR applicator was studied in this, publication, and then there is another publication which was evaluating the same handpiece for improvement of scars, and we can see that some clinical results where the patient before the treatment and then 4 weeks follow-up. However, after 6 weeks, we can see the improvement in the texture of the skin and the discoloration of the skin, the significant improvement, and this was 2 weeks after the second treatment. We can use it around the eye in order to improve some of the static wrinkles around the eye and also the wrinkles on the cheek, as we can see. So this is 3 months after 3 FSR treatment, and this is very important to let everyone know that the expectations should be like that. So the longer we wait after the treatment, the better the result is, because it's a gradual process where we are stimulating the collagen synthesis and we need the collagen to be remodeled, which is a gradual process happening after the new collagen formation in the skin. This is another patient with acne and acne scars, and we can see that the acne scars improved significantly in Asian skin patient, where they are very much prone for hyperpigmentation. So we can see that it's not only the active acne improved, not only the acne scars improved, but even the PIH improved in that patient, where we are able to deal with the different layers of the skin at the same time. What about skin laxity? So with the RF, we get dermal heating, and with dermal heating, we get immediate change in the collagen structure and long-term stimulation of neocollagenesis starting at 4 to 6 weeks after the treatment. So that's why it's very important to let the patient know that this is a gradual process and the improvement is going to continue to happen after finishing the 3 sessions up to 6 to 8 months after the last session. The thermal effect can help reduce the appearance of wrinkles and laxity and improve contours on both the face and the body. So why the OnDemand radiofrequency technology is better? We have different types of radiofrequency. We have the monopolar radiofrequency, where we have the electrode on the skin and then the grounding plate in another part of the body. So the electricity is going through the whole body, and that's why this is associated with pain and higher incidence of complications. Then we have the bipolar radiofrequency, where the penetration depth is half the distance between the two electrodes of the device. And then we have the multipolar and the 3 deep, which is a very unique technology used by OnDemand. So the OnDemand technology is the only RF device with 6 generators to phase control delivery. The energy in this case penetrates deeper beyond the epidermal dermal junction because of the repelling of the electrical charges by the different levels of electrodes. So that's why we can get deeper penetration than any regular bipolar radiofrequency. So this is the multi-source phase controlled RF, where we have 6 RF source controlled polarity of RF. This will enable to manipulate the RF current, and the energy goes deeper into the skin. This is happening while the treatment is very comfortable and it is safe at the same time, because we have lower energy density. So the safety feature in the OnDemand RF is that there is a motion sensor, where the pulse is emitted only if the handpiece is in motion. If the practitioner stops or becomes too much slow, then it is going to stop or decrease the radio frequency. Also, there is tissue contact sensor, so the pulse is emitted only if the handpiece is in full contact with the skin, and this is very important in order to avoid arcing and burning of the skin. So this is another safety feature. The third one, the real-time impedance, and this is important to measure and fine-tune the treatment parameters according to the skin properties. So those are 3 important safety features which ensure efficacy and safety of the OnDemand RF. And then recently they have the mini shaper, which is the next generation of the RF transducers, where we have focused 3 deep RF handpiece. So in this case, we are applying the shaper concentric 6 multi-source electrodes technology to smaller face and body areas, and that's why it is able to treat even difficult areas. And this will ensure better efficacy with less power. And this handpiece is allowing easier circular movement and better access to hard to treat face areas. And that's why this is a very unique handpiece. I enjoy a lot working with it. We have other options for the handpieces, like the iFine handpiece, which is used for the periorbital tightening and wrinkle reduction, and perioral wrinkle reduction as well. Then we have the small handpiece, where it is used for facial tightening and neck tightening. And then we have the contour RF and vacuum technology, where it is used mainly for the body treatments, whether it's cellulite reduction or body tightening or any body treatment. There are different studies which was published regarding this RF handpiece and the skin laxity and the treatment of wrinkles, and another study about the circumferential reduction using the OnDemand Pro radiofrequency system. And this was a 12 months follow-up, and the conclusion was that it is very effective even in circumference reduction and body shaping. We can use it for the face, and we can see the tightening which we are able to achieve using the OnDemand RF. And here we can see that the treated area is much better than the untreated area. So we can see the improvement in skin laxity can be achieved. So we have different treatment indications, like the cellulite reduction, treating stretch marks, tightening and contouring, the RF microneedling for some scars, the neck lifting, the skin resurfacing, treatment of acne scars, eye lifting, wrinkle reduction, and jawline contouring. So all those are treatment indications with the OnDemand device. The benefits of non-invasive RF includes the fact that it is clinically effective. It is 100% of your clients will benefit. We are going to get very reproducible results. It can be done simply, safely, and cost effectively. There is no consumables in the RF, no per treatment cost, and there is no downtime. It is a procedure which is associated with no downtime at all. So I believe the non-invasive RF should be part of comprehensive aesthetic skin health program, and this is something which will need almost in every single patient we are seeing. Now we talk about another handpiece which I really like, which is the intensive handpiece, which is having microneedling radiofrequency, and this is the latest advancement in the delivery of RF energy. In a patient like that who had acne scars and they have dark skin, fractional lasers are not very safe, and sometimes it's going to be increasing the problem by having higher incidence of post-inflammatory hyperpigmentation. Also in large pores, we can see that it is sometimes challenging, but microneedling radiofrequency is one of the best tools which we can use. There are different indications for intensive microneedling radiofrequency, where we can use it for acne scars, we can use it for deep wrinkles, we can use it for treating stretch marks, and for dilated pores. All those are different indications where we can use the intensive RF handpiece very effectively and very safely at the same time. The concept of microneedling radiofrequency started with a very simple device, which is the derma roller, the collagen induction therapy roller, where we are rolling this disposable roller over the skin in several directions. With the microneedling radiofrequency, we have two concepts which are used with this technology, where we are using the needling along with the fractional radiofrequency. To discuss the mechanism of action of this microneedling, we go back to this publication in July 2006 in Nature journal, which is one of the highest impact factor journals in the medical field, which was discussing electrical signals control wound healing and the role of this electrical signals. So they discovered that inside our cells, without any trauma in the resting phase, there is a negative electrical potential of minus 50 to minus 70 millivolts, as we can see here. So this is without any injury. When we have injury happening to our skin, we are going to see that there are different changes happening in the skin, but one of the most significant changes is the increase in the electrical potential from minus 50 millivolt up to minus 100 millivolts. So this jump in the negative electrical potential was found to have a significant role in stimulating the proliferation and the repair mechanism. Moreover, they found that when steel needles were inserted into the skin, the negative electrical potential will increase not only to minus 100 millivolt, but to minus 150 millivolt. And with this significant increase in the negative electrical potential, this is going to stimulate the proliferation of the cells so that repair mechanism is taking place and we get new collagen formation through this increase in the negative electrical potential. But this is not the only mechanism of action. They found also that when we when we insert multiple needles into the skin, there is migration of fibroblasts because there is acute inflammatory reaction happening in the skin. When fibroblasts migrate to the area, then those cells are responsible for new collagen formation. In addition to that, when we are inserting multiple needles into the skin, there is increased blood supply to the area, blood circulation increase in this area. With blood circulation, we get more nutrients and more growth factors. So those are the mechanisms of action of the microneedling. So in order to summarize the benefits of microneedling, we get increase in negative cell potential. We increase the local blood circulation, more nutrients and more growth factors. Stimulate mild inflammatory reaction, so fibroblasts will come to the area with formation of new collagen. In case of scars and fibrotic tissue, it will break and fragment the fibrosis because with the inflammation generated, we are going to have an enzyme called collagenase. And collagenase is responsible for eating up and decreasing the fibrosis in the area. And that's why we can improve the scars with the microneedling. And finally, the needling will increase the absorption of topical agents. And this is something which has been proven through a study where we can see that the added benefit is to enhance the delivery of topicals like cosmeceuticals, biologicals, PRP, and pharmaceuticals. So if we do needling and apply those agents on the skin, then the penetration is going to be much more significant, and this is something we can use for the delivery of those topical agents into the skin. This was studied in Marburg University in Germany through a thesis to prove the enhanced transdermal delivery. They applied some liposomes on the skin without any needling, and they found that the maximum was 0.3% can penetrate the stratum corneum. And then they performed needling on the skin and applied the same liposomes, and they found that up to 200 times more material or substance was able to penetrate into the skin. So this was a proof that the transcutaneous delivery of substance can increase significantly after the microneedling. Here I would like to stress on the fact that in order to achieve transcutaneous delivery, needle length of 0.3 to 0.5 is enough. However, if we need to achieve collagen stimulation, then the depth of the needle should be above 1 millimeter. And that's why the home use rollers are not going to stimulate collagen, which are 0.3 to 0.5 millimeter in length only. Those are good to enhance the absorption of the topical agents. but they are not going to stimulate the collagen synthesis. And this is a clinical result after 3 sessions of the treatment where microneedle radiofrequency was combined with some growth factors on one side and microneedling radiofrequency alone on the other side. And we can see that the area where combined treatment was used was significantly better than the area where microneedle radiofrequency alone was used. And this was 4 weeks after 3 sessions. So in order to summarize, the benefits of combining the needling with the radiofrequency is controlled heating of the dermis and subcutaneous tissue, enhanced dermal collagen remodeling, immediate change in the collagen structure, and finally long-term stimulation of neocollagenesis at 4 to 6 weeks after the treatment. We have with the radiofrequency the non-invasive RF or the RF microneedling. Of course, it would seem to be easier not to have needles. However, we already knew and learned that with the microneedling we are having additional benefits, which is enhancing and improving the quality of the skin significantly. It is very important to realize that needle design and insertion is definitely important to optimize the treatment outcome, and not all the devices in the market are the same. So some of the devices are having non-insulated needles, and some of them are having insulated needles. With insulated needles, the companies, the manufacturing companies, are claiming that this is safer, it doesn't have any impact on the epidermis, and we don't have any issues. The producers of the non-insulated needles are saying that this is more effective, and because the radiofrequency is going to be emitted along the whole shaft of the needle, which is inserted into the skin, so we get more surface improvement because the treatment is much more homogeneous and all the cross-section of the skin is treated. So the effect is going to be just like if you combine the radiofrequency with laser. What about safety? When we look at the safety, we are going to discover that the radiofrequency generation is dependent on the amount of water in the tissue. So the more water in the tissue, the more heat is generated. And when we are worried about the epidermis, we have to know that the epidermis is having significantly less water content than the dermis, and that's why the heat generated at the level of the epidermis is significantly less than the heat generated at the level of the dermis, and that's why even the non-insulated needles are safe. Another important factor is the quality of the needle, the diameter of the needle and the quality. So when we have a thick needle like what we have in the photo here, this is going to be much more painful, and it is going to be associated with a bit longer downtime. When we have the right needle diameter, then the penetration is going to be much easier, much less painful, and it is not going to be associated with long downtime. Also, the quality of the needle is very important, because if we have poor quality of needle, then the needle with the multiple insertions is going to be bent, as we can see here. And when it bends, it works like a hook, and this can cause minute fibrosis. So it's very important to ensure that we are using good quality products and tips. And also, I would like to highlight that the tip of this and also the dermal roller is a single use. So we should not use it more than once, even if it is for the same patient, because with the wear and tear, even the good quality needles will have this effect, and it is not healthy, not good for the skin. There are different insertion modes with different technology. So we have manual, where traumatic, usually short needle and uncontrolled. This is with the rollers. Then we have the spring, which is shooting the needles into the skin, can be traumatic to the epidermis and is very painful. And then we have the electronically controlled motorized insertion, like the intensive handpiece in the OnDemand technology, where the needles are inserted slowly and smoothly without extensive trauma to the epidermis. And that's why the pain associated with this is definitely less than with other devices I have used. The tissue effect is just like the non-ablative fractional laser, and that's why I think that anything can be achieved by the non-ablative fractional lasers can be achieved with a microneedling radio frequency with the right configuration. We can see the patient before the treatment, immediately after the treatment, and we can see the footprint of the handpiece, where we can see the areas treated with the areas not treated, and then within 24 hours everything is almost back to normal. And that's why I consider this treatment not associated with downtime, minimal downtime. And this is the histopathology, where we can see the impact, the coagulation of the upper dermis, which is going to be associated with stimulation of collagen later on. So we can see the depth and the width of the lesions. And this is 4 days after the treatment, the histology, where we can see that the epidermis is completely intact without any problem, and the inflammation is still going on in order to sensitize the new collagen formation. And this is a patient who was treated, and this was 5 weeks after one intensive treatment, and we can see the improvement in the quality of the skin, the tightness of the skin, and the more homogeneity of the skin after the treatment. So it is clinically proven that we get very good results. This is the horizontal. This is the horizontal static wrinkles in the forehead, which is improved after a few sessions of the microneedling radio frequency without the need of fillers. And I think this is a great achievement to be able to improve the quality of the skin like this. And we can use the same technology for the periocular rejuvenation, where we can go very close to the eyelashes without any problem, because it's not laser. So we can determine the appropriate skin needle depth according to the thickness of the skin, and then we can treat around the eye, and we can improve the skin laxity and the wrinkles in the periocular area in a very significant way. Stretch marks, as I said, it is very challenging. However, with the right combination, we are able to improve the stretch marks significantly with the microneedling radio frequency. Sometimes we do combination with PRP as well to enhance the result and improve the outcome, but it is really one of the best technologies which can work on that indication. And this is a publication which I had in 2013, about 7 years ago, about fractional radio frequency with microneedling for treating acne and acne scars. It's open source on Prime Journal. So if you search the article, you can find the full article on that journal, which is having a lot of facts about treating acne and acne scars using the microneedling radio frequency. This is a patient with acne, Asian patient with acne, and we can see the significant improvement. So it can be used for treating active acne as well. Again, another patient with active acne, and we can see the improvement using the microneedling radio frequency, the intensive handpiece of OnDemand. And a third case of acne. And here I would like to highlight that the Asian skin is very much prone for hyperpigmentation. So when we are able to use a technology safely and effective in that skin type, it is really a great achievement. And this is another study which was published in Laser in Surgery and Medicine about skin rejuvenation by microneedling fractional radio frequency treatment of Asian skin, clinical and histopathological analysis, where we can see that the collagen induction 4 weeks after the final treatment was very clear, and we can see in different patients that we were able to get very good stimulation of the collagen 4 weeks after the final and the third treatment. And this is the Pro Collagen 1 baseline and 4 weeks after the final treatment, and again baseline after 4 weeks after the final treatment, and we can see the significant increase in the Pro Collagen 1. This is the elastic fiber, and the same thing. We can see baseline and 4 weeks after the final treatment, and we can see the increase, significant increase in the elastic fibers in the skin histopathologically. So it is an improvement which really stays in the skin for years. This is the patient I showed in the beginning for large pores, and we can see the improvement in the pores. Asian skin, no hyperpigmentation, almost there is no downtime, and we can see very significant improvement in the pores of the skin. And this is another complicated patient with multiple issues, acne scars of different types, large pores, some hyperpigmentation. We can see that with the right combination, dealing with the epidermis and the dermis, and also tightening the skin, we can get very nice, very homogeneous, very natural improvement of the skin. And this is the patient also I showed at the beginning with multiple issues, with a combination of treatment tackling the different layers of the skin, whether it's FSR or the OnDemand Pro, the radio frequency, or the microneedling radio frequency. Together, we are able to improve the skin in a very significant way, tackling the different layers of the skin. And this patient we saw before, another patient, and we can see the tightening effect and the collagen stimulation after 3 months, after 3 sessions, and we can see how significantly we can improve the quality and the look of the skin. A patient who was treated with microneedling frequency with dark skin, and we can also see the significant improvement in the different areas of acne scars with no downtime, with no hyperpigmentation, although the patient's skin is dark. Another patient, and we can see the improvement in the acne scars in the cheek and the temple. Another patient of acne scars. And this was an interesting study about a split phase comparison between the fractional microneedling radio frequency compared with the fractional carbon dioxide laser therapy in acne patients. So in those patients, half of the patients were treated with microneedling radio frequency, and the other half of the phase of those patients was treated with the CO2, fractional CO2 laser. And the result was that the microneedling radio frequency and the fractional CO2 were associated with moderate improvements in most patients, and the number of active acne lesions was significantly decreased in both sides. So they were both clinically equivalent. When it comes to the downtime, the microneedling radio frequency was associated with significantly less downtime. So the downtime after the CO2 was about 12 days, 11.8 days, whereas with the microneedling frequency it was 2.4 days, so it was 5 times shorter than the fractional CO2. The authors are saying that we attempted to treat patients twice with the same protocol, but most patients refused because of the downtime associated with the CO2. They wanted to be treated only with the microneedling radio frequency. This is what the authors of this study claimed. So when we are having a technology which is as effective as the fractional CO2 laser, however, it's associated with much less downtime and less incidence of complications, then definitely this is a winning technology, and we would use it definitely in a much more convenient fashion. So we have different options. We have the RF, we have the RF FSR, we have the RF microneedling. This is what OnDemand platform can provide. They are definitely clinically proven. They are excellent for treating patients of color with textural concerns, scars, wrinkles, and pores. They are very effective in acne and acne scarring, and they are associated with minimal downtime. So thank you very much for your attention, and if you have any questions, please don't hesitate to let me know. Thank you.